Do you know the warning signs of a brain stroke? A brain stroke, also known as a cerebrovascular accident, is a serious health event that occurs when blood supply to a part of the brain is cut off. This medical emergency can cause lasting brain damage, long-term disability, or even death. That's why understanding its warning signs is crucial. Early detection can make all the difference. It can lead to timely medical intervention, potentially saving a life or preventing serious long-term effects. Yet, the signs of a stroke can be subtle and easy to miss, especially if you don't know what to look for. Over the course of this video, we will unravel the mystery of these signs, breaking them down one by one. We will explore each of the 8 key warning signs of a stroke, from sudden numbness to severe headaches. So, buckle up for a journey of knowledge and awareness. Stay tuned as we delve into the 8 warning signs of a brain stroke. The first warning sign you should pay attention to is sudden numbness or weakness. Now let's take a moment to delve a bit deeper into this. Imagine being in the middle of a casual conversation or perhaps preparing dinner, when out of nowhere you feel a sudden loss of sensation or strength. This could manifest in various ways. Maybe your arm feels heavy, your hand seems unresponsive, or perhaps your leg gives way beneath you. Interestingly, this numbness or weakness typically affects one side of the body, making it a rather telling sign. It's as if an invisible line has been drawn down the center of your body, with one side functioning normally and the other not. This is a common sign of a stroke, and it's not something you should ignore or brush off as fatigue or a temporary glitch. If you notice this sign, seek immediate medical attention. The second warning sign is sudden confusion or trouble understanding. Picture this. You're in the middle of a conversation, and suddenly, the words coming out of your friend's mouth seem like a foreign language. Or perhaps you're reading your favorite book, and the letters start to jumble together, making no sense at all. This is what sudden confusion can feel like. When a stroke occurs, it disrupts the blood flow to an area of the brain. This can affect a person's cognitive abilities, making it hard for them to think clearly or understand simple instructions. They may have difficulty remembering things, making decisions, or even recognizing familiar faces and places. It's not just about feeling a little foggy or forgetful. We're talking about a sharp, sudden change in mental status. It's like walking into a thick fog where everything becomes unclear and disorienting. Remember, sudden confusion is not normal and requires immediate medical attention. Trouble speaking or understanding speech is another sign of a potential stroke. Picture this. You're in the middle of a sentence and suddenly your words are slurred or garbled. Or maybe you're listening to someone else and it's as if they're speaking a foreign language. This can be a terrifying experience, and it's one of the primary symptoms of a stroke. Stroke victims may find themselves struggling with their speech. They might slur their words, making their conversation sound muddled and unclear. Alternatively, they may have difficulty understanding what others are saying. It's as if the brain's language center has been scrambled, causing a disconnect between thought and communication. This is not a symptom to be taken lightly. It's a serious warning sign that requires immediate attention. The quicker you recognize these symptoms and seek medical help, the better the chances of minimizing the damage. If you or someone else is having trouble speaking, don't delay in seeking help. Vision problems in one or both eyes can be another warning sign. The brain is a marvel of interconnected highways, and when a stroke occurs, it's like a traffic jam on one of these routes. This can impact the signals traveling between your eyes and your brain, leading to sudden vision disturbances. One might experience blurred vision as if looking through a foggy window. It's not about your eyes needing rest or a new pair of glasses, but rather, it's your brain struggling to process the visual information correctly. Similarly, a stroke could cause blackened vision, like a curtain being drawn across your field of view. Or you may start seeing double, as if everything has a twin. The world becomes a confusing, disorienting place. And here's the crux of it all. These changes can happen suddenly and without warning. Never ignore sudden vision changes. They could be a sign of a serious condition like a stroke. The fifth warning sign is sudden difficulty walking or loss of balance. This may seem like an ordinary stumble or a momentary loss of balance, but don't be too quick to brush it off. When the brain experiences a stroke, it can result in sudden dizziness. You might feel as though the world is spinning around you, or you may struggle to keep your footing. The loss of balance or coordination isn't just about standing or walking. It can also affect your ability to hold objects or perform routine tasks. You might find that your hands are shaking, or you can't seem to hold on to things as well as you usually do. And then there's trouble walking. This could be a feeling of weakness in your legs, a sudden stumble, or even a fall. You may feel as though your legs are not obeying your brain's commands or as if they've turned into jelly. If you notice these symptoms, it's crucial to seek medical attention immediately. A sudden, severe headache with no known cause is another warning sign of a stroke. This is not your average headache, my friends. We're talking about a sudden explosion of pain that you've never felt before. And this isn't the kind of headache that can be shrugged off with a quick lie down or a couple of aspirin. This headache can feel like a bolt of lightning striking your skull. It can be so severe that it's often described as a thunderclap. It's a level of pain that's impossible to ignore. And if it's accompanied by dizziness, altered consciousness, or vomiting, it's a major red flag. Why does this happen? Well, a stroke disrupts the normal flow of blood to the brain. This can cause a sudden increase in pressure in the head, leading to an intense headache. So remember, don't take severe headaches lightly. They might be signaling a stroke. Be aware, stay alert, and always prioritize your health. Fainting or a sudden loss of consciousness can be a sign of a stroke. Now, this may sound alarming, but it's essential to understand why this happens. When a stroke occurs, it's because the blood supply to part of your brain gets interrupted or significantly reduced, depriving brain tissue of essential oxygen and nutrients. This disruption can lead to a sudden loss of function, such as consciousness. Fainting, on the other hand, can occur due to a sudden drop in blood pressure, reducing the blood flow to your brain. It's a response by your body to ensure that your brain gets the blood it needs. While fainting can happen for a variety of reasons, when it's accompanied by other stroke symptoms like confusion, trouble speaking, or severe headache, it becomes a matter of serious concern. Remember, time is of the essence when dealing with a potential stroke. If someone faints or loses consciousness, call emergency services immediately. The final warning sign of a stroke we'll discuss today is face drooping. This is not your typical tiredness-induced sagging of skin. It's a sudden, noticeable drooping on one side of the face. It could feel as though your face has become heavy or numb, almost as though you've just come back from a dental appointment with an anesthetic still in effect. It's crucial to understand that this is not a sign to be dismissed or overlooked. The reason behind this drooping is due to the brain not being able to communicate effectively with the muscles in your face, a direct result of a potential stroke. Think of your face as a canvas, and your brain as the artist. If the artist suddenly loses control of half the brush strokes, the painting, that is your face, will certainly look off balance. So if you or someone around you experiences sudden face drooping, seek immediate medical attention. Remember, face drooping is a serious indication of a possible stroke. We've now covered the 8 warning signs of a brain stroke. They range from sudden numbness, often on one side of the body, to confusion and trouble speaking. Vision problems can also be a sign, with difficulty walking not far behind. A severe headache that appears out of nowhere and fainting or falling unconscious are also key indicators. Finally, watch for face drooping, a classic symptom that's easily identifiable. Each of these signs is a puzzle piece, and together they paint the picture of a potential stroke. Understanding them is crucial, as early detection can make a world of difference in treatment outcomes. Every second counts when a stroke hits, and recognizing these signs could save a life, maybe even your own. The key takeaway here is not to ignore these signs. They're your body's way of sounding the alarm. Remember, time is of the essence when dealing with strokes. Recognize the signs and act fast.